My name is Ward Blanchard. I'm CEO and founder of the Blanchard Institute and human service professional for over 20 years. And I want to talk to you about the importance of the sphere of influence. That's the loved ones and closest family members that are closest to and closest around the identified patient. That sphere of influence has the most ability to impact and influence the identified patient. When we talk about that your identified patient doesn't have to want it to get better, that doesn't have to be motivated to get better, that their frontal cortex is not working properly, then there's an understanding of what can the family and loved ones, the sphere of influence do to really impact and empower change in the identified patient. It really comes with the understanding that the identified patient's brain takes about 18 months to 2 years to heal. It takes 2 years to stabilize this process. That's called neuroplasticity, the retraining of the brain's pathways, and it takes every bit of 18 months to heal. It does heal, it does come back, but it takes every bit of that length. And so during that time of the first year, year and a half, the identified patient's brain and cognitive functioning is not up to par. And so although unfair, the best prognosis happens when the sphere of influence understands that they have to set boundaries that influence the loved one to comply as long as possible for their brain to heal. That's exactly what we talk about when our understanding that your loved one doesn't have to want it to get better in the beginning, but in the end and in the long run, when their brain heals, then they want it. One of the most common statements that 12 steps make is what? Come in here and fake it until you make it. Come in here and comply until your brain heals, and then you want it. That's exactly why there's a sober date and a surrender date. Those are two different things. And so in the beginning, when your loved one's brain is not working properly through untreated mental health issues or untreated substance use disorders, in that beginning period, families and loved ones, that sphere of influence, learning and getting professional direction to understand what boundaries do we put down to influence the loved one to comply with treatment provides the best prognosis. Because it's our understanding, if you think about this being any disease, the better that they follow professional direction, the higher the prognosis. It's like a prescription of antibiotics. If I give you a prescription of antibiotics and tell you to take 20 pills in 20 days, the best prognosis is if you comply properly with the medication. Not if 10 days in you decide to Google WebMD and let emotions dictate treatment and then you do whatever you want to do. Prognosis is probably not going to be that good. And so families following the professional's direction, putting down the boundaries, learning what those boundaries are through professional direction to force your loved one to comply provides the best treatment.